2026 is turning into one of the most damaging years Medicare has ever seen. And if you or someone you love is on Medicare, I need you to stop what you're doing right now and really listen, because what I'm about to share is already impacting millions and millions of seniors across the United States. Entire Medicare plans have just been dropped from over 400 counties nationwide by the largest insurance companies in the country. That's not speculation. That's not fear-mongering. And that's not a typo. Over 400 counties. And the most disturbing part is this. Many people affected by this don't even realize it yet. They won't find out until they go to the pharmacy, or until they show up at a doctor's appointment, or until a bill arrives in the mail that makes their stomach drop. My name is Frank, and this is Retirees Info. For years, I've helped people navigate Medicare, healthcare benefits, and financial assistance, breaking down complicated systems into plain English that actually helps real people make real decisions. I've sat at kitchen tables with families trying to figure out what went wrong. I've watched people panic when they realize their doctor is suddenly out of network. I've helped my own family members deal with confusing insurance changes that no one properly explained. And last year, throughout 2025, I kept saying the same thing over and over. Get ready. Medicare is changing. And not in a good way. At the time, some people thought I was being dramatic. Others thought it was just another normal Medicare year. But behind the scenes, I was seeing warning signs I had never seen before. Plans quietly disappearing, insurance companies pulling out of entire regions, major shifts happening without clear explanations to the people who would be hurt the most. Now we're in 2026, and I can tell you with certainty, it's worse than we expected. Today, we're going to walk through this together, slowly and clearly. I'm going to explain. What exactly is happening with Medicare in 2026? Which insurance companies are dropping plans in counties? Who is being affected the most? What the crosswalk policy is, and why it's causing so many problems. The real stories I'm hearing from people just like you. And most importantly, what you can do right now to protect yourself. This isn't about politics. This isn't about scare tactics. This is about your healthcare, your doctors, your medications, your financial security. Please stay with me, because this information could literally save you hundreds or even thousands of dollars and prevent a lot of unnecessary stress. Let's start with what's actually happening. Two of the largest Medicare insurance providers in the country have made massive changes going into 2026. United Healthcare has dropped Medicare plans in 225 counties across the United States. And they've added plans in only 14 counties. Let that sink in. They dropped 225 counties and added 14. That is not normal. Humana has also made major cuts. Humana has dropped plans in 198 counties and added plans in just 5. So between United Healthcare and Humana alone, we're talking about over 400 counties where Medicare plans have simply disappeared. And I want to be very clear about something. That number does not include smaller insurance companies. There are other providers, regional and national, that are also dropping plans, reducing coverage areas, and quietly pulling back. So the real number of affected counties is likely much higher. This is impacting millions of seniors across the country. And I know that because I see your comments every single day. People saying, I can't see my doctor anymore. My prescription went from $5 to $60. I showed up to my appointment and they said they don't take my insurance. I didn't change anything. Why did this happen? If you're a senior on Medicare living in one of these counties, this affects you. If you're caring for an aging parent whose plan was suddenly dropped, this affects you. If you qualified for Medicare early due to a disability, this affects you. Veterans who rely on Medicare alongside VA benefits, this affects you. And if you're a son or daughter trying to juggle work, kids, and elderly parents while now having to untangle insurance chaos, this affects you too. I see you, and I know how overwhelming this feels. If you've already been impacted by this, I want you to drop a comment below. Tell us what happened. Tell us what county you're in. Tell us what changed. This community exists, so people don't feel alone in moments like this. Now, I need to explain something that's absolutely critical to understand in 2026. Because for many people, this one policy explains why everything suddenly feels broken. It's called the crosswalk policy. And if you've never heard of it before, that's not your fault. Here's what the crosswalk policy is. When an insurance company decides to discontinue a Medicare plan, they're allowed to automatically move you into another plan that they believe is similar. They look at your old plan and they say, okay, this plan is going away, so we'll place this person into a plan that looks kind of like it. You don't fill out paperwork. You don't actively enroll. It just happens. On paper, that sounds helpful. But in real life, this is where a lot of people are getting hurt, because similar does not mean the same. Your premium might look the same, the plan name might sound familiar, the insurance card might even look nearly identical, but behind the scenes, your doctor network may be completely different. Your prescriptions may be on a different formulary. Your hospital system may now be out of network. Your out-of-pocket costs may be much higher, and many people don't discover this until it's too late. They find out at the pharmacy counter. They find out in the doctor's office. They find out after missing care they needed. This is why I've been saying this for over a year now, and I'm going to keep saying it. The premium can be a distraction. Just because your monthly cost looks the same does not mean your coverage is the same. And in 2026, that misunderstanding is costing people dearly. If this video is helping you understand what's really going on with Medicare, take a second and hit the subscribe button. I put out updates like this because these changes are happening fast, and most people aren't being clearly warned. Before we go any further, let me do a quick reset, especially if you're just joining us or had to step away for a moment. We are talking about major Medicare changes happening in 2026. Two of the largest insurance providers in the country, United Healthcare and Humana, have dropped Medicare plans in over 400 counties nationwide. Because of this, millions of people have either lost their plan entirely or been automatically moved into a new plan through something called the crosswalk policy, and many people don't even realize their coverage has changed until they try to use it. If that sounds familiar, you are in the right place. Let's talk about what's really being taken away from people when these plans change. Because this isn't just paperwork. This isn't just a new card in the mail. This is real healthcare. The number one thing people are losing is access to their doctors. I can't tell you how many messages I've received that start with, "I've been seeing this doctor for 10 years. This specialist knows my entire history. This doctor saved my life." And then suddenly they're told, "We no longer accept your plan." That's devastating. Healthcare is built on trust. And when that trust is disrupted, it causes stress, fear, and delays in care. Here's what's happening. When you're automatically moved into a new plan, the provider network often changes, even if the insurance company name stays the same. The plan name sounds similar, the premium stays the same. The list of doctors and specialists that are considered in-network may be completely different, so people assume everything is fine until it's not. I've heard from people who showed up to an appointment they'd been waiting months for. They checked in at the front desk like normal, and then the receptionist looked up and said, "I'm sorry, we don't take your insurance anymore." No warning, no phone call, no letter that made it clear what was happening. Just confusion and embarrassment. That should never happen. Now let's talk about hospitals, because this is even more serious. Some of these new plans do not include the same hospital systems. That means your local hospital might be out of network. The hospital you've always gone to in an emergency might not be covered. The specialists tied to that hospital system may no longer be accessible, and in an emergency, you don't get to shop around. This is why these changes are so dangerous when people don't know about them ahead of time. Another massive issue people are facing is prescription drug costs. I've seen comment after comment saying the same thing. My prescription used to cost $5. Now it's $60. Now it's over $100. Now they're telling me it's not covered at all. And people are asking, how is that possible? I didn't change anything. But something did change. Your drug formulary likely changed when your plan changed. A formulary is simply the list of medications your plan agrees to cover and how much they'll charge you. Different plans have different formularies. So when you're moved to a new plan, a drug that was Tier 1 might now be Tier 3. A generic might suddenly require prior authorization. A medication might be removed entirely, and no one explains this clearly unless you ask. If you're feeling angry listening to this, that makes sense. If you're feeling anxious, that makes sense too, because healthcare should not feel like a guessing game. Now let's talk about one of the biggest mistakes people make. And I don't say this to judge anyone. This is completely understandable. People focus almost entirely on the monthly premium. They look at their new plan and think, well, the premium is the same, so I guess nothing really changed. But in 2026, that assumption is costing people dearly, because the premium is only one small piece of the puzzle. Here are the things that can change even when the premium stays the same. Your doctor network, your specialist access, your hospital system, your prescription costs, your deductible, your co-pays, your coinsurance, your maximum out-of-pocket limit. Any one of those can dramatically affect your healthcare costs. And many people don't realize that until they're already locked into the plan. Let me say this again because it's that important. Same premium does not mean same coverage. Not in 2026. Not with these changes. Now, a lot of people ask me, Frank, why are insurance companies doing this? And I want to be honest with you. I'm not here to defend insurance companies, and I'm not here to speculate wildly, but what we do know is this. Healthcare costs are rising, utilization is higher than ever, and insurance companies are pulling back from areas they see as higher risk. The result? Seniors are left dealing with the fallout. If this information is helping you understand what's really going on, please take a moment to hit the subscribe button and share this video with anyone you know who's on Medicare, your mom, your dad, your grandparents, your neighbor, someone at church. This information can prevent a lot of heartache. Before we move forward, let me pause for just a moment and do a quick reset. If you're just joining us, we're talking about the massive Medicare changes happening in 2026. Over 400 counties across the country have lost Medicare plans from major insurance providers. Millions of people have either lost their plans entirely or been automatically moved into new plans through the crosswalk policy, often without fully understanding what changed. And now we're focusing on the most important question of all. What should you do right now? Step 1. Confirm your plan status. The very first thing you need to do is confirm exactly what plan you are on right now. Not what you think you're on, not what you were on last year, what you are on today. That means look at your most recent insurance card. Check any letters or notices you received late last year or early this year. Log into your insurance provider's website if you can. If something looks different, even slightly, don't ignore it. Small differences often signal big changes underneath. Step 2. Verify your doctors. Do not assume the second step is absolutely critical. You must verify that your doctors are still in network. And I want to be very clear about this. Do not assume your doctor is covered just because they were covered last year. They accept the same insurance company. They usually take Medicare networks change, contracts change, and in 2026, they are changing a lot. Call your doctor's office directly and ask, do you accept my specific Medicare plan for 2026? Write it down. Get confirmation. This one step alone can prevent a lot of painful surprises. Step 3. Check your prescriptions. One by one. You need to review your prescriptions. And yes, that means every single one. Even the ones you've been on for years, even the ones that used to be cheap, because formularies change quietly. Check. Is the medication still covered? What tier is it on now? Do you need prior authorization? Has the copay or coinsurance changed? If something doesn't look right, don't wait. Prescription costs are one of the fastest ways Medicare changes hit people financially. Step 4. Confirm your hospital access. Now let's talk about hospitals. This is something many people never check, but they should. Ask yourself, which hospital would I go to in an emergency? Which hospital system do my doctors use? Then verify that hospital is a network under your current plan. Because when you need a hospital, you don't get to pause and research coverage. This step is about protecting yourself before something happens. Step 5. Understand your out-of-pocket risk that includes deductibles, copays, coinsurance, maximum out-of-pocket limits. Two plans can look very similar on the surface and behave very differently when you actually use them, especially if you see specialists, have ongoing conditions, take multiple prescriptions. Knowing this ahead of time helps you avoid financial shock later. Now, here's something a lot of people don't realize. If your Medicare plan was discontinued or your county was dropped, you may qualify for a special enrollment period. That means you may be allowed to change plans outside of the normal enrollment window. But, and this is important, you usually need to act within a limited time. If you miss that window, your options may become much more limited. This is why waiting and hoping things work out can be risky. And this brings me to something I want to say very clearly. You should not have to figure all of this out by yourself. Medicare is complicated. The rules are confusing. And the changes in 2026 have made everything harder. Getting help does not mean you failed. It means you're being smart. If your plan changed, your county was dropped, or you're unsure what coverage you're really on, I strongly encourage you to connect with a trusted Medicare advisor. This is free help. Someone who understands the system, someone who can look at your specific situation, someone who can help you compare options and avoid costly mistakes. Thousands of people in this community have already done this, and many of them tell me it was a huge relief. You deserve healthcare that works for you. You deserve to see the doctors you trust. You deserve medications you can afford. You deserve clarity, not confusion. And even though the Medicare system is changing fast in 2026, you still have options. If you've gone through a plan change this year, or you're in one of the counties that was dropped, I want you to leave a comment below. Share what you're seeing. Share what surprised you. Share what you wish you'd known sooner. Your experience might help someone else avoid the same problems. Before we wrap this up, let me pause for just a moment and reset again because this is important. We're talking about the Medicare changes happening in 2026 that have already caused over 400 counties across the country to lose Medicare plans from major insurance providers. Millions of people have either lost their plans or been automatically moved into new plans without fully understanding what changed. And if this has happened to you, I want you to hear this clearly. This is not your fault. One of the hardest parts of all of this isn't even the paperwork. It's the emotional toll. I hear it in your messages. I read it in your comments. People feel stressed, angry, confused, afraid to make the wrong decision. Some people tell me, I feel stupid for not knowing this. I thought Medicare was supposed to be simpler. I don't trust the system anymore. If you felt any of that, you're not alone, and you're not wrong for feeling that way. Medicare is not simple. It is layered. It is technical. And in many ways, it is designed in a way that makes it hard for regular people to fully understand without help. That does not mean you failed. It means the system failed to communicate clearly. And in 2026, that failure is showing up in a big way. One of the most important takeaways from everything we've talked about today is this. You can no longer assume that your Medicare plan will stay the same from year to year. Those days are over. Plans are changing more frequently. Counties are being dropped more aggressively. Networks are shifting faster than ever. That means being proactive is no longer optional. It's necessary. Protecting your health care going forward means doing a few key things consistently. First, it means reviewing your coverage every single year, even if you've been happy with it in the past. Second, it means asking questions early, not waiting until something goes wrong. And third, it means having someone you trust who understands Medicare and can help you navigate changes when they happen. This is not about panic. This is about preparation. You are one of more than 70 million people on Medicare. You've paid into the system. You've worked hard. You've earned these benefits. You deserve coverage that actually works for you, not coverage that surprises you at the worst possible time. And while we can't control what insurance companies decide to do, we can control how informed and prepared we are. If your plan changed, your county was dropped, or you're unsure whether your current coverage is truly right for you, please don't wait. Connect with a trusted Medicare advisor. This is free help. There is no obligation, and it could make a huge difference in your peace of mind and your healthcare costs this year. Having someone in your corner matters, especially in a year like 2026. If this video helped you understand what's happening, please take a moment to support this channel. Hit the subscribe button so you don't miss future Medicare updates. Use the share button to send this video to your parents, your grandparents, your neighbors, your friends, anyone you know who's on Medicare. This information can genuinely protect people. And don't forget to leave a comment below. Tell me, if your county was affected, if your plan changed, or if you're still trying to figure out what happened. This community is here to support each other. I know these changes feel overwhelming, but knowledge is power. The more you understand what's happening, the better decisions you can make, and the more control you regain over your health care. Thank you for spending this time with me. Thank you for being part of this community. And thank you for looking out for yourself and the people you care about. Until next time, take care of yourself, protect your healthcare coverage, and I look forward to reading your comments. I'll see you in the next video.